The Isle of Man cervical screening programme invites all people with a cervix aged 25 to 64 years to be screened for cervical cancer. Until recently, 25 to 49-year-olds have been invited every 3 years, with 50 to 64-year-olds invited every 5 years. The UK National Screening Committee has recommended that the 25 to 49-year-olds are now invited every 5 years instead of 3 if they test negative for HPV virus. We have reviewed the UK NSC recommendation and the research behind it, and due to the way we provide cervical screening on island, we're able to safely make this change and move from a 3 to a 5 yearly testing interval. So, due to the successful implementation of primary HPV testing in the Isle of Man in 2018, we have been able to screen and detect the risk of cervical cancer much earlier than we previously could. The current screening programme detects high-risk HPV, the virus responsible for over 99.7% of cervical cancer cases. It takes 10 to 15 years for cervical cancer to develop from an HPV infection, and in most cases the body gets rid of the infection through its immune response before any changes occur. Detecting HPV infection before any cell changes have happened means we can safely monitor the infection and treat those that the body isn't getting rid of before they cause cervical cancer. This also means that if a screening test is negative for HPV, the risk of cervical cancer is very low, and we don't need to do any unnecessary invasive screening for another 5 to 10 years. In the Isle of Man, we will be offering the routine screening after 5 years for all age groups. So from July, anyone who attends for screening, tests negative for HPV and is on routine recall will be invited again after 5 years for another routine test. So from the 1st of July, anyone who is screened for cervical cancer and gets a negative result for HPV will automatically be recalled for their next appointment in 5 years' time. If your test returns a positive result for HPV, your follow-up may be different depending on your results, and we will discuss and agree this with you at the time. No, there is no change to how the test is carried out. We are still testing for HPV, which identifies the risk a person has of developing cervical cancer. HPV is the infection responsible for 99.7% of cervical cancer cases. With this test, we have a better chance of identifying and treating the underlying cause before it develops into cancer. While nearly all cervical cancers are caused by high-risk HPV, a very small number are not, so it is important to be aware of symptoms such as unusual vaginal discharge or bleeding, bleeding after sex, between periods or after the menopause. And if you experience any of those symptoms, you should go and see your GP. The HPV vaccination is available for young people up to the age of 25. This helps to reduce your chances of getting the virus and therefore developing cervical cancer. To find out more, you can visit gov.im/HPV. You can visit the website gov.im/cervical screening to find out more about eligibility, the testing process and your results. When you receive an invitation for your cervical screening, we encourage you to take it up. You can make an appointment at your GP or by calling the Stay Well Clinic on Mondays or Thursdays between 9 AM and 2 PM on 642 638.